Encephalopathy is one of the most infrequent documented diagnoses in the medical record. Documentation of alteration in a mental status, change in attention, memory loss, or personality change are clues used by coders that a query for encephalopathy is a possibility. Alcoholic liver disease, liver cirrhosis, or hepatitis can cause hepatic encephalopathy. A diseased liver cannot filter out toxins from the body, including the brain. Patients with hepatic encephalopathy suffer from sleep disorders and changes in moods, along with other symptoms. Encephalopathy is common in severe infections. Bacteria and viruses can cause inflammation of the brain. Elevated blood pressure can affect the brain's function. This can cause hypertensive encephalopathy. Decreased blood pressure, hypotension, has the same effect. Metabolic encephalopathy, or toxic metabolic encephalopathy, is due to electrolyte imbalances. This can include high or low blood sugars, hyperglycemia and hypoglycemia. Hyperkalemia or hypokalemia, elevated or decreased sodium levels. Dehydration is a common cause of metabolic encephalopathy. Side effects of medication can also cause metabolic encephalopathy by decreasing the brain's function. Head trauma can cause encephalopathy due to an increase in pressure within the skull. This can be due to a bleed. If the pressure is severe, a decrease in the blood flow through the brain can occur, resulting in alteration of mental status. A patient can be anoxic, which the condition of no oxygen to the brain. A patient can be hypoxic, which is decreased oxygen to the brain. Common causes of anoxic or hypoxic encephalopathy include cardiac arrest, cardiorespiratory failure, prolonged or uncontrolled seizures, asthma or COPD, benign or malignant brain tumors, increased pressure within the skull, and decreased blood flow. This too can cause a significant alteration in the patient's mental status, leading to encephalopathy, due to the fact that encephalopathy is usually secondary to a primary condition. Diagnostic workup and treatment is usually directed at resolving the primary condition. This includes antibiotic therapy and rehydration for infections and sepsis. Treatment of traumatic head injury can include relieving the increase in intracranial pressure. Physicians who are concerned that a patient may have encephalopathy will order increased neurological monitoring by nurses. Nurse and documentation of neurology checks will include current signs and symptoms of the patient's mental condition. The goal is for the patient to return to their normal mental status. Encephalopathy is often a secondary condition documented as alteration of mental status during the examination. If a patient is admitted for an altered mental status or documented encephalopathy, the physician will order diagnostic tests to look for the cause. Labs for infections and electrolyte abnormalities will be performed. A CT or MRI of the head will be ordered to rule out head trauma or tumor. A spinal tap can be performed to look for infectious disorders. Ammonia levels are measured for increased levels of ammonia in the blood, which is toxic to the body. An increase in ammonia can be commonly caused by liver and kidney disease or failure. Common clinical indicators of encephalopathy include altered mental status, uncontrolled diabetes, attention disorder, alcoholism, bacterial, fungal, or viral infections, sepsis, fatigue and weakness, lethargy, headache, hyper or hypoglycemia, hypertension or hypotension, hyperkalemia or hypokalemia, kidney failure, memory loss, mood change, nausea and or vomiting, personality change, sleep disorder, seizures, toxic exposure. Common diagnostic tests for encephalopathy include ammonia levels, blood toxicology, CT head, cerebral spinal fluid study, drug screen, electroencephalocardiogram, electrolyte tests, liver enzymes, and MRI of the head. Common therapeutic treatments of encephalopathy include antibiotics, neurological monitoring, patient safety checks, oxygen therapy, and treatment directed towards the resolution of the primary condition that caused the encephalopathy. Possible query options for encephalopathy include acute encephalopathy, encephalopathy due to drugs, hepatic encephalopathy, alcoholic hepatic encephalopathy, hypertensive encephalopathy, hypoglycemic encephalopathy, hypotensive encephalopathy, metabolic encephalopathy, parainfectious encephalopathy.